Hello and welcome. Today we're diving deep into a serious condition that affects the kidneys and blood, hemolytic uremic syndrome, or HUS. We'll explore its causes, how it damages the body, the symptoms to watch out for, and what can be done to treat and prevent it. So, what causes HUS? The most common culprit is infection with Shiga toxin-producing bacteria, often E. coli O57-H7. This strain is typically acquired by eating contaminated food, like undercooked ground beef, unpasteurized milk or juice, or even through contaminated water, less frequently. This can be caused by other bacterial infections, viral infections, certain medications, or even underlying genetic conditions. These non-E. coli-related cases are often referred to as a typical HUS or a US. Now, let's understand the pathophysiology, or how HUS actually damages the body. The Shiga toxin produced by the bacteria enters the bloodstream and damages the lining of blood vessels, especially those in the kidneys. This damage leads to three key features of HUS: hemolytic anemia, where red blood cells are destroyed, thrombocytopenia, a low platelet count which impairs blood clotting, and acute kidney injury, where the kidneys are unable to properly filter waste from the blood. HUS is more common in children, especially those under the age of 5. Outbreaks are often associated with contaminated food sources. While it can occur worldwide, the incidence varies depending on hygiene practices and food safety standards. A typical HUS, being linked to genetic factors or other illnesses, is rarer and can affect individuals of any age. Recognizing the signs and symptoms of HUS is crucial for early diagnosis and treatment. Initially, symptoms can resemble a stomach bug, abdominal cramps, vomiting, and diarrhea, which may be bloody. As the condition progresses, individuals may experience fatigue, decreased urination, swelling, particularly in the face, hands, and feet, paleness due to anemia, and even neurological symptoms such as seizures or confusion in severe cases. Diagnosing HUS involves a combination of physical examination and laboratory tests. Blood tests will reveal evidence of hemolytic anemia, low platelet counts, and kidney dysfunction, as indicated by elevated creatinine and blood urea nitrogen levels. Stool samples may be tested for Shiga toxin-producing E. coli. In cases of suspected atypical HUS, genetic testing or complement pathway analysis might be performed to identify underlying causes. While we've touched on typical and atypical HUS, it's important to briefly clarify this distinction. Typical HUS is primarily associated with Shiga toxin-producing E. coli infections, as we've described. Atypical HS, or HUS, encompasses cases caused by genetic mutations affecting the complement system, other infections, medications, or autoimmune disorders. Differentiating between these types is crucial because treatment strategies can vary significantly. The treatment for HUS focuses on supportive care and addressing the underlying cause, if possible. This includes intravenous fluids to maintain hydration and electrolyte balance, blood transfusions to correct anemia, and dialysis to support kidney function if necessary. For typical HUS, antibiotics are generally avoided as they can potentially increase the release of Shiga toxin. In cases of atypical HUS, therapies targeting the complement system, such as eculizumab, may be used to prevent further blood vessel damage. Prevention is key in reducing the incidence of HUS, particularly the typical form. Thoroughly cooking ground beef to an internal temperature of 60,000 degrees F or 71 degrees C is crucial. Avoid consuming unpasteurized milk, juice, or cider. Wash fruits and vegetables thoroughly before eating. Practice good hand hygiene, especially after using the restroom or handling raw meat. Ensure water sources are safe and properly treated. The prognosis for HUS varies depending on the severity of the condition and the promptness of treatment. Many individuals, especially those with typical HUS, recover fully with supportive care. However, some may experience long-term kidney damage, requiring ongoing management or even dialysis. A typical HUS can have a less predictable course and may require long-term complement inhibiting therapy. Recent research is focusing on developing more targeted therapies for HUS, as well as exploring new diagnostic tools for early detection of HS in general. These advances offer hope for improved outcomes for those affected by this serious condition.